Our group will present question number 1. So the question is, Mariam and Mustafa, a married couple, hold different nationalities. Mariam, a Malaysian citizen, recently completed her Bachelor of Pharmacy with honours at the University of London. On the other hand, Mustafa, who is a Canadian, is a registered pharmacist in Canada and also graduated from University of London 5 years ago. They both plan to obtain registration as pharmacists in Malaysia. For question 1A, how many types of registration for pharmacists? The answer is, there are 3 types of registration for pharmacists in Malaysia based on the Registration of Pharmacists Act 1952. So firstly, provisionally registered pharmacists. Secondly, fully registered pharmacists. Based on Section 8, application for registration, in subsection 1, any person entitled to be provisionally or fully registered under this Act may apply to the registrar for registration accordingly, as stated in this subsection, for both provisionally registered and fully registered pharmacist registration. So thirdly, temporary registration as stated in section 11A. For temporary registration, in subsection 2, the board shall issue a temporary registration certificate to a person temporarily registered under subsection 1.
Question B. With reference to the ROPA and ROPR, describe the various procedures and requirements Mariam needs to fulfill to qualify herself as a fully registered pharmacist. So Mariam, as a Malaysian citizen and pharmacy graduate from University of London, need to fulfill the following procedure and requirement under the Registration of Pharmacists Act 1951 and Registration of Pharmacists Regulation 1994. So firstly, to be a provisionally registered pharmacist in Malaysia, as stated in Section 6, in subsection 1, Mariam must hold any qualification specified in the first schedule, or a qualification in pharmacy, other than the qualifications referred to in paragraph A, deemed suitable for registration by the Minister after consulting the board. Next, Mariam must pass the qualifying examination to practice pharmacy. This national exam assesses pharmacy knowledge and skills needed to safe and effective practice in Malaysia. After passing QEPP, Mariam needs to complete 12 months of supervised practical training in an approved pharmacy setting under the supervision of a registered pharmacist in Malaysia.
Mariam needs to be registered as a provisionally registered pharmacist (PRP), as stated in Section 6A, subsection 2. The provisionally registered person shall immediately upon being provisionally registered engage in employment as a pharmacist to the satisfaction of the board for a period of not less than 1 year in any of the premises listed in the second schedule. After completing PRP, Mariam shall be entitled to full registration, as stated in Section 6B, subsection 1, subject to the provisions of this Act. No person shall be entitled to be a fully registered pharmacist under this Act unless he has gained experience as required under Section 6A or been exempted under subsection 6A(7). After 2 years of work experience as a PRP, Mariam can apply for FRP, making her a fully independent pharmacist in Malaysia.
For question 1 part C, can Mustafa register as a pharmacist in Malaysia? As stated in section 11A subsection 1, the board may, upon application in writing, temporarily register a person who is registered as a pharmacist outside Malaysia, subject to such condition and restriction as the board deems fit to impose. Since Mustafa has registered outside Malaysia, he can register in Malaysia with few additional conditions. Additional condition that Pharmacy Board sets is firstly, non-citizen pharmacist married to a Malaysian citizen. Since Mustafa has married to Mariam, who is Malaysian citizen, he has passed this condition. Following that, Mustafa have to follow 3 other conditions. Firstly, Mustafa must has a degree in pharmacy that recognized by Pharmacy Board Malaysia, which listed in first schedule. Mustafa already had his degree of pharmacy from University of London. Secondly, Mustafa must take and pass the qualifying examination to practice pharmacy in Malaysia. And lastly, must be registered in home country, which Mustafa also have passed this condition because he is a registered pharmacist in Canada. Since Mustafa follows all the criteria set by the Pharmacy Board, he can temporarily register in Malaysia. That is all from us. Thank you.